Electrolyte replacement. Electrolyte, EL, equals element that carries an electric charge when dissolved in water, helps maintain homeostasis. 1. Bone plus tooth formation. Ca is helpful in treating magnesium intoxication and helps strengthen myocardial tissue after defibrillation or poor response to epinephrine. Hypocalcemia is common in tetany, cardiac arrest, vitamin D deficiency, parathyroid surgery, alkalosis. Monitor Ca levels, S/S of hypercalcemia, drowsiness, lethargy, muscle weakness, headache. C. ECG changes. Short QD, heart block when giving PO. Calcium don't take with foods that interfere with absorption, e.g. Bone plus tooth formation. Ca is helpful in treating magnesium intoxication and helps strengthen myocardial tissue after defibrillation or poor response to epinephrine. Hypocalcemia is common in tetany, cardiac arrest, vitamin D deficiency, parathyroid surgery, alkalosis. Monitor Ca levels, S/S of hypercalcemia, drowsiness, lethargy, muscle weakness, headache. C. ECG changes. Short QD, heart block when giving PO. Calcium don't take with foods that interfere with absorption, e.g. spinach, rhubarb, whole grain cereal, fresh fruit plus vegetables. Magnesium, Mg+, function of Mg, transmits nerve impulses to muscle, activates enzymes for carb plus protein metabolism, stimulates parathyroid secretion, aids in cell metabolism. Used to prevent deficiency, control seizures, treat/prevent preeclampsia, and treat ventricular arrhythmias. Hypomagnesemia is common in malabsorption, chronic D, prolonged diuretic use, NG suction, hyperaldosteronism, hypoparathyroidism, excessive release of adrenocortical hormones. Mg taken with digoxin equals can lead to heart block. Monitor Mg levels, S/S of hypermagnesemia, hypotension, circulatory collapse, flushing, depressed reflexes, respiratory paralysis. Administering 4 mg too quickly can lead to cardiac arrest. Sodium, Na+, major cation in extracellular fluid. Function of Na, maintains osmotic pressure, acid-base balance, water balance, aids in nerve conduction and neuromuscular function. Aids in glandular secretion. Hyponatremia is seen in anorexia, excessive GI loss, excessive perspiration, overuse of diuretics, trauma. Syed to replace Na. Sodium chloride 4 is usually given. Side effects, pulmonary edema, hypernatremia, and K+ loss. S/S of pulmonary edema equals SOB, cough, anxiety, wheezing, pallor. Electrolyte relationships, sodium/potassium, inverse, high Na equals low K. Calcium/phosphorus, inverse, high Ca equals low phos. Calcium/vitamin D, similar, high Ca equals high Vit D. Magnesium/calcium, similar, low Mg equals low Ca. Magnesium/potassium, similar, low Mg equals low K. Magnesium/phosphorus, inverse. Low Mg equals high phos. Anti-Alzheimer's. Increase ACH in CNS by inhibiting cholinesterase. Cholinergic effects equals excessive salivation, cramps. D. Blurred vision, bradycardia. Desired outcome, temporary improvement in cognitive function. Antianemics. Iron is needed for production of hemoglobin, which is necessary for O2 transport to cells. Desired outcome, resolution of anemia. Antianginals. Nitrates are used in acute treatment of angina pectoris. Calcium channel blockers plus beta blockers are used in long-term management. Nitrates dilate coronary arteries and cause systemic vasodilation. Monitor for hypotension. Desired outcome, decrease in frequency plus severity of anginal attacks, increase in activity tolerance. Anti-anxiety medications causes generalized CNS depression. Avoid use in pregnant patients. Monitor for suicidal ideation. Desired outcome, decrease in anxiety level. Antiarrhythmics. Class 1A, quinidine, procainamide, disopyramide. Class 1B, lidocaine, phenytoin, mexiletine. Class 1C, flecainide, propafenone. Class 2, esmolol, propranolol, metoprolol. Class 3, amiodarone, ibutylite, sotalol. Class 4, diltiazem, verapamil, adenosine, atropine, and digoxin. Assess apical pulse before administration. Desired outcome, resolution of arrhythmia. Antiasthmatics includes adrenergic bronchodilators, corticosteroids, anticholinergics, leukotriene receptor antagonists, and mast cell stabilizers. Do not use corticosteroids, long-acting adrenergics, or mast cell stabilizers during an acute asthma attack. O desired outcome, prevention of and reduction in symptoms of asthma, anticholinergics, atropine for bradyarrhythmias, ipratropium for bronchospasm, scopolamine for motion sickness, glycopyrrolate for gastric secretions, benztropine for Parkinson's disease, oxybutynin plus tolterodine for urinary spasms, contraindicated in narrow-angle glaucoma, severe hemorrhage, tachycardia, and myasthenia gravis or anticholinergic effects equals dry mouth, dry eyes, blurred vision, constipation. Desired outcome: increased heart rate, dry mouth, dilated pupils, decreased GI motility, and resolution of S/S of Parkinson's. Anticoagulants prevent and treat clot formation, DVT, PE, and atrial fibrillation. They do not dissolve clots. Pregnant patients should not take warfarin. Monitor for signs of bleeding, bleeding gums, nosebleed, unusual bruise, black stool, hematuria. Monitor PTT, heparin, and INR, warfarin. Heparin OD equals protamine sulfate, warfarin OD equals vitamin K. Desired outcome: prevention of clotting without signs of hemorrhage, prevention of stroke, MI, and death in patients at risk. Anticonvulsants act by depressing abnormal neuronal discharges in the CNS. Fetal hydantoin syndrome can occur in offspring of patient receiving phenytoin during pregnancy. Monitor serum drug levels routinely. Do not discontinue abruptly. Can precipitate status epilepticus. Desired outcome: decrease or cessation of seizures without excessive sedation. Antidepressants prevents the reuptake of dopamine, norepinephrine, and serotonin. Should not be used in narrow-angle glaucoma or in pregnant/lactating patient. Tricyclic antidepressants have anticholinergic side effects: dry eyes, dry mouth, blurred vision. Taking an MAOI with tyramine-containing food can lead to hypertensive crisis. Avoid alcohol and other CNS depressants. Desired outcome: resolution of depression, decrease in anxiety. Management of chronic neurogenic pain. Antidiabetics. Insulin is used in T1DM, whereas oral agents are used primarily in T2DM. Insulin lowers blood glucose by increased transport of glucose into cells plus promotes conversion of glucose to glycogen. Patients exposed to stress, fever, trauma, infections, or surgery may need a change in insulin dose. Desired outcome: control of blood glucose without hypo/hyperglycemia. Antidiarrheals slows intestinal motility and propulsion. Desired outcome: decrease in diarrhea. Antiemetics inhibit and diminish motion sickness. Phenothiazines are to be used cautiously in children with viral illness. Antifungals affect the permeability of the fungal cell membrane or protein synthesis within the fungal cell. Use cautiously in patient with depressed bone marrow. Full course needs to be taken. Desired outcome: resolution of S/S of infections. Antihistamines block the effects of histamine at the H1 receptor. Also have anticholinergic properties. Dry eyes, dry mouth, blurred vision. If used with opioid analgesic, monitor for increased sedation. Desired outcomes: decrease in allergic symptoms, decreased anxiety, relief of pruritus. Antihypertensives includes alpha agonists, beta blockers, vasodilators, ACE inhibitor, ARBs, CCB, and diuretics. ACE inhibitors and ARBs should be avoided in pregnant patients. Abrupt discontinuation can lead to rebound HT and encourage weight reduction. Low sodium diet, regular exercise, cessation of smoking plus alcohol use. Desired outcome: decrease in blood pressure. Anti-infective skill or inhibit growth of bacteria. Culture and sensitivity should be done before to optimize treatment. Prolonged use can lead to superinfection or resistant bacteria. Full course needs to be taken. Desired outcome: resolution of S/S of infections. Antiparkinsonian drugs aims to balance ACH and dopamine. There is a lack of dopamine and excess of ACH in Parkinson's. May cause drowsiness/dizziness. Desired outcome: resolution of Parkinsonian and extrapyramidal S/S. Antiplatelets treat and prevent thromboembolic events, stroke, MI, by inhibiting platelet aggregation and prolonging bleeding time. Desired outcome: prevention of stroke and MI. Antipsychotics block dopamine receptors in brain. Atypical antipsychotics have fewer side effects compared to typical antipsychotics. Not to be used in patients with narrow-angle glaucoma or CNS depression. Can cause neuroleptic malignant syndrome, fever, RESP, distress, tachycardia, convulsions, diaphoresis, blood pressure change, pallor, muscle stiffness, loss of bladder. Control. Desired outcome: decrease in excitable/paranoid/withdrawn behavior. Antipyretics inhibit prostaglandins. Most antipyretics also affect platelet function, may cause Reye's syndrome if ASA is given to children with varicella or viral illness. O desired outcome. Reduction in fever. Antiretrovirals' goal for HIV is to improve CD4 cell count and decreased viral load. These drugs do not cure HIV, nor does it decrease the risk of transmission. Desired outcome. Decrease in viral load plus increase in CD4 count. Antirheumatics manage symptoms of RA, pain plus swelling. Corticosteroids are reserved for advanced symptoms due to the side effects. Do not use corticosteroid in patient with active untreated infects. Anti-ulcer drugs. H2 receptor antagonists plus proton pump inhibitors contraindicated in pregnancy. Administer antacids 1 hour before or after other oral medications. Desired outcome. Decrease in GI pain/irritation, prevention of GI bleeding, healing of ulcers. Decreased GERD/S. Antivirals used for management of herpes virus infects, chickenpox management, prevention of influenza infects, treatment of cytomegalovirus, treatment of ophthalmic viral infects. Inhibits viral replication. Need to take full course of therapy. Desired outcome. Prevention/resolution of S/S of viral infects. Beta blockers used for HTN, angina, tachyarrhythmias, migraines, MI, glaucoma, and heart failure. O beta 1 receptor sites equals located in heart. Stimulation results in increased HR and contractility. O beta 2 receptor sites equals located in bronchial and vascular smooth muscle plus uterus. Stimulation produces vasodilation, bronchodilation, and uterine relaxation. Monitor BP, HR, intake plus output, and daily weight. Abrupt withdrawal can lead to rebound HTN plus tachycardia. Desired outcome. Decreased BP, decrease in frequency severity of angina, arrhythmia control, prevention of MI, prevention of migraines. Bronchodilators. Beta 2 agonist therapeutic effects can be antagonized by beta blockers. Desired outcome. Decreased bronchospasm, increased ease of breathing. Calcium channel blockers for HTN, angina, and coronary artery spasm. Blocks calcium entry into cells of vascular smooth muscle and myocardium equals dilates coronary arteries. Safety in pregnancy is not established. Do not crush/open sustained release capsules. Monitor for orthostatic hypotension. Desired outcomes. Decreased blood pressure, decrease in frequency/severity of angina, increase in activity tolerance. Central nervous system stimulants used for narcolepsy and management of ADHD, increases levels of neurotransmitters in CNS, respiratory stimulation. Dilated pupils, increased alertness, diminished sense of fatigue, if used with MAOI, can cause hypertensive crisis. Avoid in patients with psychotic personalities. Abrupt cessation can lead to extreme fatigue and mental depression. Desired outcome. Decreased narcoleptic episodes, improved attention span. Corticosteroids treat adrenocortical insufficiency. Also used for the anti-inflammatory, immunosuppressive, and antineoplastic activity. Contraindicated in serious infections. Desired outcome. Suppressed inflammatory and immune response, replacement therapy in adrenal insufficiency, and resolution of skin inflammation. Diuretics used for HTN, edema, and heart failure. Safety in pregnancy is not established. Hypokalemia can increase the risk of digoxin toxicity. Monitor daily weight, intake plus output, edema, lung sounds, skin turgor. Monitor for orthostatic hypotension. Desired outcome. Decreased BP, decreased urine output, decreased edema, reduced ICP. Immunosuppressants used to prevent transplant rejection. Use cautiously in patient with infects. Safety in pregnancy is not established. Monitor for infects, air vitals, WBC, urine, sputum. Lifelong therapy is needed to prevent transplant rejection. Desired outcome. Prevention or reversal of rejection of transplanted organ. Laxatives treat constipation and prep the bowel for procedures. Include stimulants, stool softeners, bulk-forming drugs, and osmotic cathartics. Should only be used on a short-term basis. Desired outcome. Soft plus form BM, evacuation of the colon. Lipid-lowering drugs. Decreases cholesterol levels. HMG-CoA reductase inhibitors are not to be used in pregnant patients. Patients should also be making changes to diet, exercise, and smoking alcohol when taking this drug. O desired outcome. Decreased LDL, increased HDL. Non-opioid analgesics controls mild moderate pain and or fever. Avoid alcohol use, increases risk of GI bleed with salicylates and NSAIDs. Desired outcome. Relief or mild moderate pain, reduction of fever.